Welcome everyone to lecture 8.2. The focus is on picture archiving and communication systems, also known as PACS. Before I dive into PACS, though, I want to talk a little bit about medical imaging and radiology and some of the different imaging that we have. So first, medical imaging is a technique or process, and in the early days it was considered an art, but it's the process for creating visual representations of the human body. These representations are intended for clinical analysis and medical intervention by highlighting hidden structures within the body and for the diagnosis and treatment of disease. And to be most useful, such medical images need to be tied to a specific patient, and that patient has a specific condition. So let's talk a little bit about radiology. So radiology employs medical imaging to both diagnose and treat disease visualized within the human body. Radiology is a medical specialty, and a radiologist is generally responsible for interpreting the results of the image, and sometimes they take the images as well. A number of imaging technologies are used today in medical practice by radiologists and clinicians. Such tools are essential components in screening, diagnosis, and treatment monitoring. The most common of these is radiography or the X-ray. Others include ultrasound, computed tomography, nuclear medicine, position emission tomography, positron emission tomography or PET scans, and magnetic resonance imaging or MRI. So let's briefly explore a few of the more common imaging techniques. So first, radiography, sorry. This was the first imaging technique available in modern medicine, and it was developed over a century ago. And so most of you have probably seen an X-ray. Radiography uses a wide beam of X-rays to acquire an image. The captured image is two-dimensional, and there are two types of radiography: fluoroscopy and projectional radiographs. Fluoroscopy uses a constant input of low-dose X-rays to visualize organs as they work and can be useful in monitoring a patient condition. More traditional projectional radiographs or X-rays are often used for assessing fractures and changes in lung status at a point in time. Both techniques are used with, or can be used with contrast mediums such as barium or iodine. Mammographies are also a form of radiography. Magnetic resonance imaging, or MRI, was introduced in the early 1980s. This technique uses powerful magnets to polarize and excite hydrogen nuclei in water molecules in human tissue, producing a detectable signal that is then spatially encoded. So the image has traditionally been a two-dimensional thin slice of a body, making it a tomographic technique. However, modern MRI can produce 3D images. In contrast to methods such as radiography that expose a patient to potentially harmful X-rays, there are no known long-term effects of exposure to date. However, other patient risks associated with the test, including tissue heating and the presence of implanted devices, must be considered in the use of this technology. Ultrasound or medical ultrasonography is different from other medical imaging techniques in that it is operated by the transmission and receipt of high-frequency sound waves. Sound waves are sent into the tissue and is attenuated based upon the tissue composition. While ultrasound technology provides less detail, it is very safe to use, making it a common imaging device in tracking fetal development during pregnancy. It also has broader uses in imaging other body organs as well. Tomography is a method of imaging a single plane or slice known as a tomogram. CT scans represent the latest generation of tomography equipment available. Like radiography, CT scans use X-rays to take pictures. However, CT scans can have a higher ionizing radiation burden than X-rays, so care is taken with regards to use. So what is PACS? I'm going to advance the slide here as well. Oh, to show you everything I have here. So PACS is picture archiving and communication system used for storing and accessing electronic medical images taken by different medical image technologies. The principles of PACS were first discussed at a meeting of radiologists in 1982. The first large-scale implementation of a PACS solution was in 1982 at the University of Kansas in Kansas City. PACS devices are considered medical devices and are regulated by the US FDA. PACS supports the storage and retrieval of a number of digital images today, including ultrasound, CT, PET, and MRI. Noticeably absent from the list is fluoroscopy and more traditional X-ray technology. PACS has at least 4 important uses that have driven standardization within the medical imaging community. PACS replaces hard copy managing of medical images with soft copy images that are easier to access and reference. PACS provides for remote access and viewing of images. Such capabilities can expedite care and support teleservice solutions, as we definitely have seen over the last couple years here with COVID, right? PACS also provides an important interface of imaging systems with hospital information systems such as EHRs, and PACS can ensure that all images are available and accessible in one place. Finally, PACS systems can provide a workflow structure for radiologists to ensure they're following a consistent process and checklist during patient exams. So the diagram here describes a typical PACS architecture. Starting from the left-hand side, a particular image type or modality is taken by the radiologist and transmitted via a gateway workstation to an image archive. The image is then available via the storage archive for viewing from a physician reading workstation. The architecture is fairly straightforward. One thing worth noting is the reference to DICOM. What is DICOM? So DICOM is Digital Imaging and Communications in Medicine. It is the standard way we handle, store, print, and transmit information in medical imaging. The communications protocol is an application protocol that uses TCP IP to communicate between systems. And then services include storing, querying and retrieving, printing, and other data management functions. And the National Electrical Manufacturers Association, or NEMA, holds the copyright to this standard. DICOM is really the glue that allows for interoperability between the various devices within a PACS system. So some of the advantages of DICOM, it's a standard way of communicating among equipment and standard data capture objects that are accessible for analysis. So it captures standardized data, right, that are accessible for analysis down the road. And I think that is it. Yes. Sorry, that was my last slide. On to the next.